Cityline, folks. We are doing an ultimate beauty special today. Today on Cityline, we are doing the biggest facial transformation we have ever done before on Cityline. It's going to be amazing. Yay. Thank you, Derek. Yay! Let me show you first a couple of the people who were responsible for this. Dr. Stephen Mulholland and Dr. Jordan Soll. Hi, guys. Part of Ella's makeover included improving her smile. Let's take a look.
Well, Ella was just a terrific lady who very much wanted to have her smile improved. Both Dr. Mulholland and I had to express to each other what our treatment plans were and how our treatment plans would impact each other's treatment plans. So with Ella, we decided to do full coverage crowns as opposed to doing veneers. The reason why we did full coverage crowns is because there was issues of the way the teeth bite together. As well, we needed additional strength. Ella's teeth had been broken down. They were very heavily restored, and so veneers wouldn't really lend themselves to this situation. So this is what I always refer to as the architectural plan. We've duplicated this model, and out of wax, we've actually prepared how the case is going to look. And what we're going to do with Ella is something that we sort of call a different kind of perfect. We're going to incorporate some of nature's own irregularities and the whole instances that you want to create something that looks just really, really natural. You all set? Okay, that's your temporaries, and the permanents are going to look even nicer. I told you we'd do a really nice job for you. Thank you. You're welcome.
Could we have found a better person to do a makeover on? Ella is so gracious. She obviously loved her new teeth. First of all, talk to me about cosmetic dentistry. What exactly is a cosmetic dentist? What does that mean?
Well, I like to say that cosmetic dentist is someone that really devotes a good part of their practice to appearance-related procedures.
Okay.
So when people come in, they're not happy with the way their teeth are looking as they age. Their teeth can chip. Color is not ideal anymore, and they want to know how they can bring some youthfulness back into their smile.
Yeah, you've got a great set of teeth on you. That's a good ad right there. Just smile at people as you walk around town. Tell me how Ella's teeth were when you met her. What did you think of her teeth? What did you think you were going to have to do?
Well, when Stephen called me and he said he'd like me to see this lovely lady, Ella came in, and in our office, right off the bat, just everybody fell in love with her. Ella's teeth were, well, they were, for lack of a better, they were in different time zones.
Okay.
The two front teeth were sort of crossing over each other. There was some gum issues. The gums weren't as healthy as they could be. Ella was missing teeth primarily on the top. So there was two things going on. They weren't attractive in appearance, but Ella also had functional issues going on. In other words, it was going to start to get harder for her to chew her food as she got older because she was missing her back teeth, and over time her bite would start to collapse. And so what we mean by that, and Stephen would see this in individuals, there's a defined distance between your chin and your nose. But if your teeth start to wear out, that distance starts to get shorter and shorter. And so we saw that starting to happen with Ella because she didn't have the back teeth to support that defined distance.
Got it. Okay, so this needed to be done.
It just wasn't an aesthetic makeover, it was a functional and aesthetic makeover.
How much, like consulting, Dr. Mulholland, you said that you brought Dr. Soll in to do this. What did you guys need to discuss, and what did you need to work out?
It's important when timing the soft tissue rearrangements or bony restructuring to know what your aesthetic dentist is going to do to the teeth, and generally one has to predominate over the other, and one needs to be healed till the other completely be done. So there's a lot of interaction needs to happen.
Right. How important would you say the teeth are? Because I think that they are just crucial. There's some people that walk around life and they don't smile. They're so conscious of the fact that they do not like their teeth. How important do you think the teeth are? Obviously, you think they're very important. That's your
absolutely.
That's your livelihood. But do you see amazing transformations like Ella's? Look at her reaction.
Absolutely. That old cliche. Your smile is the window to your soul.
Yeah.
And if you smile and you're happy about how your smile looks, your whole face is going to light up. But as you get older, it's not just the appearance, it's also do you have the ability to chew your food.
Not only that, they always have a health study. There's one out every single day of the week, usually contradicting the one that came out the day before. But the latest ones are saying that the health of your teeth and your mouth are a reflection of your overall health. Is that true?
Yeah, absolutely.
Absolutely true.
The more and more research is defining that the health of your gums, the health of your teeth, can definitely influence the health of your body. They found that people who have heart disease much later in life, they trace it back to people who've had gum disease.
Wow. Okay. The second mold there, that was sort of the ideal mold. That's where you wanted to get to with Ella's mouth?
Yes.
Did you get there?
Yes, we did.
So it was absolutely a success in your eyes.
This is the equivalent of an architectural plan.
Wow.
And so when Ella came in, we had to obviously gather certain records. We had to see what we were working with. I needed to coordinate with Stephen because Ella actually had to have some gum surgery first. As I said, the gums weren't as healthy as they should be, and the gums have to heal a certain amount of time. When Stephen does his work, I have to stay away.
Yeah.
So we're trying to make sure that we're working in coordination so that we shorten the healing time as much as possible.
Are there less expensive options for people?
There certainly are less expensive options. You can start off by giving yourself a very pleasant change by just whitening your teeth. And then from whitening your teeth, you can, if you have little chips on your front teeth, just either recontouring or doing a little bit of bonding, and it's a fantastic pick-me-up. Okay,
great. Thank you for that, Dr. Soll.
When you have a smile, the whole rest just takes over. It's just amazing. I can't even put it into words. It really, really lightens up your face, the way you think, the way you talk. Before I would talk into my hand, I would talk like this, and now it's like, I'm talking. I just got more self-esteem. Yeah, a lot more self-esteem. And it's going to get better. I just know it.
You've got to be dying to meet her. The Ella we've been talking about throughout the entire show. Everyone, Ella. Give her a big round of applause. Come on up, Ella. You look fantastic.
Thank you.
How do you feel?
Like Cinder-Ella?
Yeah. You're looking a little like Cinderella.
Well, thank you.
Talk to me about this whole journey.
Oh, this journey's been amazing. My feet has not touched the ground. I'm loving this. I don't walk with my head down anymore. I'm smiling and saying hi to people on the street.
To strangers?
Yeah, strangers.
Hi, I'm Ella.
Getting
Look at me, I'm pretty.
Getting phone numbers pushed in my hand and getting on the bus for free.
Me. Get out of town. Are the men all over you?
Oh, yeah.
Well, that is thanks to your two doctors. Thank you, Dr. Mulholland and Dr. Soll. You're getting her dates. Good work. Very good. Listen, we chatted a little bit before the show, and almost only 2 words came out of your mouth, and you were in tears. This is why people love you, though. You're so happy about this change, and I think that's what people like to see. They like to see somebody who they didn't feel like their insides were being reflected on the outsides, and that's why they went for cosmetic surgery. Is that how you felt?
I remember walking into the office, and he said, "What did you want to accomplish?" I go, "For my inside to be like on the outside."
Yeah.
Yeah.
And do you feel that way now?
I do, and more so.
Can I talk to your babies, because they're here as well?
You sure
Your
can.
2 kids? All right, let me talk to them. What's your name, sweetie?
Randall.
Randall, how old are you?
I'm 15.
Okay, so you're the son. Tell me what you thought when your mom said, "I'm going to go in, I'm going to get this done."
Really? I was disappointed.
Oh, really?
And then after to hear her that she said it'll make her happy, made me feel good. So I had to, I don't know.
That's all you needed to hear, right? It'll make mom happy and you're happy with it. How about you? What's your name?
Alicia.
Alicia, how old are you?
14.
Okay, how did you feel? How do you feel about the makeover?
Excited?
Are you excited for her?
Yeah.
Is she hot?
Well, I can't judge her.
I can't call my mom hot. She's absolutely gorgeous. So you're happy for her, though, huh?
Yeah.
Okay, fantastic. So tell me how this has changed your life. Are there things that you're going to be doing differently now? I know you're smiling down the street, you're getting digits from all the guys, and you feel confident about yourself. Are there other changes that are going to come out of this?
The changes that I'm going to try to make. Before I would take something lower level, but now I'm going to reach for the stars. Yeah, for sure.
And is there anyone that is sort of skeptical about this big change? Is anyone acting a little weird around you now that you're this new fabulous self?
Actually, no.
Good.
No, not at all.
Fantastic.
Yeah.
I'm so excited for you. You're so lovable. Thank you so much, Ella. Stay with us as well. We're going to have the results of our live makeover in the audience, and we're going to talk to Ella a little more after the break. Stay with us. Take a look at Ella before and Ella now. Look at that. You know, what's interesting about all this is that we've sort of encapsulated this very big transformation. People are seeing it within the hour of the show. And, you know, people don't necessarily get a sense of how big this is, how much time this takes, how much thought goes into it, the recovery. So talk to me a little bit about what people need to think about before they go and do something like this.
Well, from my perspective as the plastic surgeon, it's a big psychological transformation.
Right.
There's a physical recovery. There's a financial commitment. You're basically taking one of the biggest commitments you'll make in your life to your physical self, and you need to set that time aside. It needs to be the right time in your life, and you need to be emotionally and psychologically committed.
What are we talking about recovery-wise? How much time?
If you break the face into thirds, let's say brow, eyes, cheek, and lower neck, each third takes about a week to 10 days. So if you do all thirds, you renovate the whole house, right down to the foundations, it's a good a month to 6 weeks till you're looking right. And so it's a lot of hiding out period, a lot of recovery period, and it can be amazing, but people have to be prepared for that. There's no weekend surgery recovery for the face, really.
All right, and talk to me about the teeth, because dramatic transformation there as well. How long are we talking about recovery-wise?
What's key for your viewers to know, this is not what many see as teeth in a day. This is something that it takes a tremendous amount of planning and a tremendous amount of execution, because I work very close in hand with my dental ceramist. He also is the one who creates the restorations, and so we want to get something that looks very natural. Nature doesn't make perfect teeth, it makes beautiful teeth with pleasing irregularities, and you want to incorporate these irregularities so that the smile looks beautiful and then in turn supports the work that Stephen does. So time-wise, it can take anywhere from 1 to 4 or 5 months.
Really? Before you're feeling totally normal with your mouth and your teeth?
No, not feeling normal, but from start to absolute finish. But what's also key to remember is at no time are you socially challenged. You're always wearing temporaries. You can always go out into social scenarios, parties, whatever. So there's no downtime from that point of view.
I'm not laughing at you. I'm laughing at these three clowns behind the camera here. You guys want to come in? It's Bill, Lisa, and Derek doing a dance behind the camera. You guys,
it's all his fault.
You guys did fantastic work. Lisa, Bill, Derek, Dr. Soll, Dr. Mulholland, fantastic job, all on Ella. Thank you so much to Ella, and stay tuned tomorrow. Cityline, it's home day. Good job, guys.